today's topic is contraindication of morphine. In which case we can't use morphine, we have to know the situation. Number 1, undiagnosed acute abdominal pain, because in case of undiagnosed pain, if we use morphine randomly, then the patient may get relief from the severe pain or any type of acute abdomen. The patient may go back home and there may be problem in his body. Number 2, head injury. In case of head injury, we can't use morphine because it causes pinpoint pupil, and we know that pinpoint pupil is an important, or constriction or dilatation of the pupil is an important sign of head injury. So if we use the morphine in case of head injury patient, it will be misguide us that what is the condition of the patient, is it due to head injury or it is due to the use of morphine. Number 3, extreme age. Extreme age means the very low age patient and very geriatric patient. These two types of patient will get poisoned by using morphine, because in case of children there is no enough enzyme to metabolize the morphine, and in case of geriatric patient the enzymes are already exhausted. In case of liver disease and kidney disease, we know that morphine is metabolized in the liver and also it is excreted through the kidney. So, if the liver and kidney is diseased, morphine will not be metabolized or excreted through the body perfectly. Respiratory distress. In case of poor respiratory function, morphine can't be used, but it causes bronchoconstriction, and the acute asthmatic patient or any COPD patient will suffer for this morphine. Convulsive disorder, morphine causes truncal rigidity. Biliary colic, renal colic, this type of case morphine can't be used, because if we use morphine there may be rupture of the bile duct or ureter. In case of pregnancy, morphine can't be used, but pethidine can be used, because morphine causes delayed labor, and it also, of course it causes analgesia, but it prolongs the time of the labor. But if we use pethidine, it will relieve the pain, but it will not delay the labor. Rather, it is metabolized by the placental enzyme. Now, why we will not use the morphine in case of head injury? Number 1, there will be pinpoint pupil. Number 2, there will be stimulation of the chemoreceptor trigger zone. As a result, there is vomiting. There is respiratory center depression. As a result, there will be accumulation of the carbon dioxide and increase the intracranial pressure. And spinal cord, there may be epileptic convulsion. So, we will not use morphine in case of head injury. Why not in the biliary colic? It causes contraction of the biliary duct and gallbladder, constriction of the sphincter of OD, and there will be rupture of the bile duct. Why not in renal colic? Because it causes contraction of the ureter and urinary bladder, constriction of the sphincter and rupture of the ureter. Why not in pregnancy? Because physiologically dependent on opium, the fetus will be physiologically dependent on opium, and there will be withdrawal syndrome in early postpartum life, and also there is respiratory center depression. Why not in the Addison's disease? Because prolonged and exaggerated action due to slow metabolism. And why not in impaired renal or hepatic function? Because impaired kidney and impaired liver cannot be metabolized or excrete the morphine perfectly. Why not in poor respiratory reserve? Because it causes respiratory depression and it also causes release of histamine. As a result, there will be bronchoconstriction and increased bronchial secretion. Now, what are the hazards of morphine? Morphine causes tolerance, addiction, constipation, vomiting, meiosis of the eye, respiratory center depression, sedation, cardiorespiratory center depression like bradycardia, hypotension, convulsion and oliguria also. Why causes oliguria? Because it stimulates the supraoptic and paraventricular nucleus. As a result, there will be released antidiuretic hormone and that causes the oliguria. Who are more prone to morphine addiction? Surprisingly, doctors, nurses, medical students and paramedics are more prone to morphine addiction because they can get easily this type of drug. Mention the feelings of the morphine addict. A patient or a man who is addicted by morphine feels euphoria, a feeling of tranquility, sleepiness in case of morphine. Now, what are the withdrawal syndrome? Withdrawal syndrome means an addicted patient, if do not take morphine, then there will be some sign symptoms in his body, and this is called the withdrawal syndrome. What are the sign symptoms? The sign symptom begins within 7 to 10 hours and it lasts for 7 to 10 days. And sign symptoms are hyperthermia, hyperventilation, lacrimation, running nose, sweating, chilling, nausea, vomiting, etc. Now, what is the treatment? The treatment may be three types. Number one, psychological. He should give the psychotherapy, not to take the morphine, and he should be rehabilitated in the society, and there should be drug therapy. The drug therapies are methadone, naltrexone, and benzodiazepine. Now, what is methadone? Methadone is a morphine-like drug. It is a weak drug. It is long-acting, orally active, এবং less addicting drug. Gradually, the dose should be tapering day by day, and the dose is 80 milligram per day. The treatment should be completed within the 7 to 10 days, because this type morphine works, working duration is 7 to 10 days. Now, it is very important slide. What are the difference between morphine and pethidine? Morphine source is natural and pethidine is synthetic. Morphine is more potent than pethidine, that means it is 10 times more potent than morphine, and onset of action is late in case of morphine than pethidine, and duration of action is shorter in case of pethidine than morphine. And what are the effects of eye? Effects of on eye is pinpoint pupil in case of morphine, but pethidine causes dilatation of the pupil. What are the effects on GI tract? In case of GI tract, there is constipation in case of morphine, and there is no constipation in case of pethidine. Antitussive effect, that is cough suppression. Cough is suppressed by morphine, but it is not suppressed by pethidine. Urinary retention occurs in case of morphine, whereas in case of pethidine there is no urinary retention. And use in labor, morphine should not be used in case of labor, because it delays the labor time, and in case of pethidine it does not delay the labor time. Why pethidine is more effective than morphine during labor? Because it doesn't delay the labor, its onset of action is quick, it is less duration of action, and it is metabolized quickly. For these reasons, morphine is not in case of delivery, but pethidine is used in case of delivery. Now, what are the antagonists of morphine? Antagonists can be divided into two types. Number one is pure antagonist, number two is partial antagonist. Pure antagonist is naloxone, naltrexone, nalmefene, and partial antagonist is nalorphine. Naloxone is short acting and naltrexone is long acting. Now, tramadol, it is an important analgesic. It is centrally acting opioid analgesic. Tramadol comes as a short note in case of written examination, so you have to memorize it some points. Decrease intracellular cyclic AMP by inhibiting the adenine cyclase. Route of administration, plasma half-life is 6 to 8 hours, and indication is treatment of the rheumatoid arthritis, restless leg syndrome, motor neuron disease, neuropathic pain, and allergic reaction and dizziness are the adverse effects of morphine. Now, I will focus some important topics: tolerance, dependence, and habituation. What is tolerance? Tolerance is gradual diminish of the response due to the repeated administration of drug like morphine, pethidine, phenobarbital causes tolerance. That means if a patient use for a long time, the drugs produce tolerance in the body of the patient. What is addiction or dependence? It is a state of periodic or chronic intoxication produced by the repeated administration of the drug, and there will be overpowering desire to procure the drug. There is a tendency to increase the dose of the drug, and there is detrimental effect of the individual and the society. And withdrawal symptoms occurs. Examples are morphine, pethidine, and benzodiazepine like diazepam. Now, the last slide, that is what is habituation. Habituation is mild form of addiction which is characterized by psychic phenomena, and there is detrimental effect to the individual but not in the society, and there is no withdrawal effect. And the examples are smoking, coffee, alcohol, tea, etc. That's all for our online session. Allah Hafiz.